First thing I want to say is good morning to everybody. Obviously, we have a lot of people on this call, and the fact that we did it virtually is because we had some issues with certain folks we really wanted in the room, being able to make an in-person meeting with New York City being, what it is in terms of having the five boroughs and folks getting from A to B and public transportation. We thought this would probably be the best way to have a discussion that is meaningful and that we can include the most amount of people possible. And it looks like we've done that. So that's very exciting. We are going to start the meeting, as Bernadette said, with introductions, and then we're going to get into our agenda. And the agenda is going to discuss four basic questions. You should have all had it, but I will repeat the questions for now. Question number one will be, how can New York strengthen support for survivors and communities? Question number two will be, what coordination and tools do law enforcement and prosecutors need to better combat traffickers and help victims? Question number three will be, what impact is the migrant crisis having on human trafficking crimes within the state? And then number four is, what kinds of education and training are needed to better equip professionals and all New Yorkers to recognize someone who needs help? Now, something that has come up in the last 7 roundtables we've done is the first question sometimes goes into education. So any comments you might have on education, we'll save to the last one, and I may interrupt based on that fact. For those that are unaware of what the task force is and how it was established, this is a task force of the New York State Assembly GOP minority, with Leader Barclay and my co-chair, Mary Beth Walsh, taking the lead. Our team and our staff and many members have hosted meetings throughout the state of New York. This is our 8th and final roundtable. We have been in Long Island, Suffolk, and Nassau. We've been in the Capital Region. We've been to Western New York, North Country, and the Hudson Valley twice. We've been all over the state. We've educated ourselves on this topic more than we ever thought we could possible. And the goal is to put a report together some point in the month of January, which is International Human Trafficking Month, and provide legislative recommendations, funding recommendations, and also some of the low-hanging fruit of public service announcements, things that we can do within our offices, within our networks to actually help. So my commitment to you before I introduce my assembly colleagues who will be on the call and then have you introduce yourselves will be, we will do our very best to make sure we don't waste your time here this morning. We aren't going to solve the issue of human trafficking in 2 hours, but we will absolutely continue to educate ourselves and listen to all of you, the stakeholders and the people with boots on the ground, who are the best people who can help us come up with recommendations that make sense, that are humane, and that would really hopefully lead to a positive change, or many of them is our hope. So that is our pledge to you. And I know that my colleagues can not stay for the entire time, but I will be on the entire 2 hours. So when they have to jump off or jump back on, we completely understand that. We're so happy you're hosting us. And I'll start out with our introductions of my colleagues. Is Mary Beth on, Bernadette?
No, Brian, I haven't seen her yet.
Okay, how about Assemblyman Novikov?
Yes. Thank you.
Okay, Assemblyman Novikov, why don't you introduce yourself, sir?
Good morning, everyone. My name is Michael Novikov. I represent the 45th Assembly District in South Brooklyn. First of all, thank you all for joining today's critical discussion. I want to begin by expressing my deepest gratitude to every individual on this call. Your dedication to combating the scourge of human trafficking in New York State is nothing short of heroic. And as we confront this grave issue, your insights and collaboration are vital to our shared mission of protecting the vulnerable and holding perpetrators accountable. And I'm sure together we are not just addressing a crime, but striving to restore dignity and hope to countless lives. I look forward to working with each of you as we chart a path toward a safer and more just New York. So thank you again for your commitment and presence today.
Thank you, Assemblyman Novikov. And now we will go to Assemblyman Sam Pirozzolo.
Good morning, everyone. How are you? Thank you, Brian, Mary Beth, to our leader for setting this task force up and having these meetings. And I'm so pleased to see so many people here on a Monday after a holiday weekend. That's truly amazing. Listen, when we talk about human trafficking, that's really something that's relatively little unknown to most people, unheard of. But unfortunately, we hear much more about it now because we see in the media these young children being dropped off at the border, and it just bleeds into the rest of what happens in this country. So I appreciate anything that we can do when we can come together. One of the things that really amazes me when I hear about human trafficking is the penalties or the punishment for the crime. And sometimes we unfortunately see in the papers, and it's just through media, that the punishment is not as significant as we think it should be. So I would love to, if we could, Brian, maybe focus some legislation this year on increasing penalties for human trafficking that exceeds penalties for, someone abusing their dog, or something like that. In my community, which is the 63rd district of Staten Island, we have growing populations of migrants, and human trafficking is certainly a concern among them. And it's about the big thing that no one likes to talk about. I don't know if it's because it's so horrific or whatever it is, but we certainly need to put a spotlight on it like we're doing this morning. I'm just reading the list of individuals who are here, and we have quite a list of significant names here. So again, I want to thank everybody for coming. If there's anything that I can do, through the Republican minority, I'd be more than happy to do that, and working with Mary Beth and Brian and all the other assembly people, and even reaching out and working with the minority. I mean, that's really what it's all about. This is definitely a bipartisan issue. So, it's just shocking that we don't realize how big of a problem this is, and that when we go to address it, it's difficult to address, and the penalties seem to be not very much. So I look forward to working with you. As I said, I have one or two people coming into my office. I am going to be popping on and off because I'm very interested in having the discussion about the 4 questions. But again, before I go, I think really the biggest issue for me is, what do we do with a person who is sex trafficking, and how do we apply penalties to them so that not only they never do it again, but people seeing what can happen will decide it's something that shouldn't be done. Thank you, Brian.
Oh, thank you, Sam. And just hearing you speak is great for me. Now, this is our 8th one. So we find that the folks on our call have given us some good feedback on a lot of what your concerns are when it comes to the federal stuff, which we'll get into, or the penalty stuff we'll get into. A lot of the laws are federal. So a lot of the investigations aren't done by state agencies, they're done by federal agencies, but we've heard from local law enforcement that they want to get more involved. The state wants to get more involved in enforcement, but we need more penalties on the books. So that's certainly an aspect of this we're going to get into, and looking forward to definitely tackling that. I believe it's item number 2. So we're looking forward to that, Sam, okay? Now going to ask Assembly Member Lester Chang to introduce himself.
Well, thank you, Brian and Mary Beth. Thank you very much, and hosting this. This is a very important topic itself. My name is Lester Chang, represent Southern Brooklyn, which represents Sunset Park, Dyker Heights, Borough Park, and Bensonhurst. Human trafficking is very common in my district. Large amount of migrants, especially the Chinese, are here. And sex trafficking is rampant here. We got tremendous amount of massage parlors here, underground sex workers here. And this is alarming because I do have people that come to my office having issues on housing and being abused by the pimps and by the customers. So we had to work closely with law enforcement about this. And one thing is very alarming. On the other side of the aisles, on the progressive Democrats, both New York City Council and the state is trying to legalize sex workers, which I'm against. And that will open up a can of worms of possibly potentially increase in sex crime, and as well as human trafficking because of that. This New York City is coming up with their decriminalizing sex workers. So that's something we have to work closely with our colleagues to see we can prevent this ever passing. And this is very important on our side, both New York City and New York State. Thank you, Brian. Thank you.
Thank you, Assemblyman Chang. And two quick things before I get into instructions for everybody. We obviously are all going to feel strongly about a lot of different aspects of this, but we do want every single person on this call, everybody, whether we are going to disagree or agree at first, we want to listen to you. We want to hear your side. We want to hear all sides. And that's been really an amazing part of this process. So as strongly as we all may feel about one area, it's really important for us to listen to everyone and know that we really want to hear your opinion on a particular issue, whether you agree with us or not. That's a big part of this. And interestingly enough, on a previous call, and I don't know if this person is on this call, there were a lot of massage parlors that were in Asian communities that actually came to us and said, hey, we're really getting targeted. Yes, this seems to be an issue, but it's not every single location. And there were some actual law enforcement issues that we maybe can get into after this, obviously. But that's another perspective, right? That, okay, we're cracking down on something, but it's leading to some folks that are trying to run a business not being able to run a business. So we want to be able to always use law enforcement, but do it in a way that doesn't hurt the people we're trying to help. So we're going to now get into introductions, but since we have the amazing opportunity here today to have so many people, we are going to try to stick to 30 seconds each, okay? So we're going to do your name, your office, your capacity, where you're from, and quickly, why are you here? Why are you on this call? Kind of what your space is. So we are going to start with the folks that have signed up. If you are a late RSVP, let's say today or even late yesterday, in the chat, put your name and your title and the organization you're with, so that when I'm done reading the list, I will then go to the chat to call on you for an introduction. So if you don't know how to do that, at the very end, I'll say, is there anyone else I haven't introduced? But if we can all get ahead of that by putting in the chat, if you have a very late RSVP like today, which is fine, just put in the chat. We're going to start out with David Weiss. Are you here?
Yes. Good morning, Assembly Member Meyer. Nice to see you again. How are you, everyone? I am David Weiss. I am the Chief of the Human Trafficking Unit at the Brooklyn District Attorney's Office and the co-chair of the federally funded Brooklyn Human Trafficking Task Force, which is a collaborative model which partners a law enforcement agency with a service provider to do collaborative human trafficking prosecution and investigation. Happy to be here.
Thank you, sir. David was nice enough to come to the Hudson Valley, so we've heard from him. He's got an amazing level of knowledge. So thanks for being here twice, David. Stephen Knopfler, did I get that right?
Close enough. It's Knepfler, but I'm used to it. I am Steve Knepfler. I am the chief of the Human Trafficking Unit at the Bronx DA's office, and I am here because I'm always interested in contributing to the discussion about how we can help survivors and victims of trafficking and what kind of legislation we can propose to improve those results.
Thank you. We appreciate you. And really being here right there in your position is going to be key. So we're going to look forward to hearing from you. New York City Police Department Detectives Bureau Representative, Special Agent Brian Gander, are you here?
Brian's with the FBI. We didn't have a name for the New York City Police.
Oh, sorry, that was it. That was a different one. Okay, so Brian Gander, are you here?
Yes, I'm here. My name's Brian Gander. I've been a special agent with the FBI for the last 22 years, all of which has been in the FBI New York office in Manhattan. The last 12 to 13 years, I've been focusing on human trafficking investigations. I'm a founding and current member of the Child Exploitation and Human Trafficking Task Force with the NYPD in my office. And I help, amongst working my investigations, also help to coordinate the human trafficking program in New York City.
Thank you for being on today, Brian. Really appreciate it.
Thank you.
Melinda Cousins.
Good morning. My name is Melinda Cousins. I'm the director of MSW admissions at Lehman College. I worked in nonprofit for about 15 years, working in child welfare and supportive housing and seeing the linkage between the two. And just I'm really interested in what we can do to support and educate incoming social work students because, like you said, our boots are on the ground.
Absolutely. Thank you for being on the call, Melinda.
Mm-hmm.
Stu Chasabenis. All right, we'll move on. Manur Jora.
Good morning. Yes, my name is Mahnur Jora, and I'm the Deputy Director of Health for Bronx Borough President Vanessa L. Gibson. I just want to say thank you for the opportunity to be part of this roundtable, and including the Bronx in this conversation because we do have some of very high rates of trafficking, and as part of that, we do convene a domestic and gender-based violence advisory council, and this trafficking overlaps with some of the work that folks and organizations in that group do. So I'm very happy to see a lot of those folks and agencies join this call, especially on such a short notice, and I look forward to being part of the conversation. So thank you.
Thank you. And we are happy that this got out to a lot of people late and folks are interested enough to get on. Appreciate having you. My friend at this point, Lori Cohen. How are you, Lori? I think we're friends now, right?
We are besties. I'm so tremendously grateful to you for organizing this meeting and extremely excited about it. My name is Lori Cohen. I'm the Chief Executive Officer of Protect All Children from Trafficking, or PACT. Those of you who are New York based and have been in the field for a while know us under our previous name, ECPAT USA. And I am somewhat shocked to say that I've been working in the field of human trafficking prevention for 20 years at this point, initially representing victims of human trafficking at Sanctuary for Families. And I see some of my colleagues from Sanctuary are still here, so welcome. And now working in the field of prevention with a focus on children. I appreciate your comments about having this be an open conversation. For us, this is sadly a bipartisan issue. Children from all backgrounds are getting trafficked, and this is affecting everyone. But I'm profoundly grateful that you organize these hearings throughout the state.
Oh, thank you very much, Lori. We're looking forward to hearing from you again. Baisi Huang.
Hi, good morning, everyone. My name is Baby Huang, and I'm a Director of Client Services at Restore NYC. A couple other staff on our team wanted to join too, but they can't make it because other schedule. Restore is a service provider based in New York City. We have a very diverse staff team, and we provide service directly in Spanish, Chinese, and English. A few of us have direct service experience in the working with Chinese women, specifically IMI for many years, including myself. We also serve a large population of Spanish-speaking survivors. Restore actually only works with survivors of trafficking, which is our mission. So this is my first time being here, and I'm happy to join. I'm very glad to join the conversation.
We're happy to have you. And I actually did a tour of a Restore New York City facility. I want to say in Brooklyn. Would that be accurate? You got a spot in Brooklyn?
There is one location. Yeah.
Yeah, I think I was there with my colleague from the Social Services Committee, and you guys had a lot of amazing resources. And what I really liked is you hired a lot of folks that had utilized the resources and then beat their addiction, beat their issues that they were having, and then became advocates and workers for you guys. I really love that model, and that you're able to do that.
Thank you.
Okay. We're going to look at Eva Chavez.
Hi, good day, everyone. I am the Training and Outreach Manager with Safe Horizons Anti-Trafficking Program, also co-chair of the Brooklyn Human Trafficking Task Force. And I work collaboratively with other task forces around the city, the state, and out of state as well. And my main interest here is to stress the acknowledgement of labor trafficking that may not include a commercial sex act, and also how we can strengthen our partnership with NYPD. Thank you.
Well, I love those two. That is a very important distinction. It's not just sex trafficking, it's labor trafficking, and it's exploitation, and all of those things have different issues, different laws that need to be addressed, different everything. And the NYPD, I really appreciate that comment, really do, because I think from what I've been seeing and hearing, that's absolutely something we all need to work on, and everybody wants to work on all sides. Okay. Shane Bloom.
Hey, thank you. I'm Shane Bloom. I'm the Deputy Director of Educational Initiatives for Curriculum and Learning with PACT. As Lori introduced, PACT is an organization that works to prevent child trafficking, and I'm here to hopefully provide some insight on how education for both youth and adults can lead to that prevention. So thank you for having me. This is my first time as well. So yeah, very excited and grateful to be here. Thank you.
Oh, don't you worry. I will not forget to have you lead off question 4 for us, okay? Carolina Lopez.
Good morning. My name is Carolina Lopez. I am a program coordinator at the New York City Mayor's Office to end domestic and gender-based violence. And we work with policies and procedures for gender-based violence, including human trafficking, and with CBOs to educate the city on human trafficking and other things, gender-based violence. Thank you.
Thank you, Carolina. Vanessa Legagnor. Vanessa, are you on? We will never know if I got her name right. All right, Diane Strom.
Yes, hi, I'm Diane Strom. I'm from Bronx Care, and I'm also the coordinator of the Bronx Human Trafficking Task Force. I'm very interested in being part of this. First of all, because of the importance of increasing medical knowledge, which is well documented as not being sufficient when it comes to identifying and caring for people who are trafficked. Also, to think about the way that we can create some kind of algorithm so that when any of us encounters a patient who has been trafficked, that we can refer to each other quickly and easily and get response as we need it for all services. And finally, to see if there's any kind of way that we can actually begin to collect meaningful data that will support what it is that we all know that what we're seeing, but that we can't ever seem to sufficiently document.
That's a really good point. It's a big reason why I started this task force. I realized a lot of the data that we have on file is it does not accurately reflect the issue. Okay, thank you for that. Dr. Peter Sherman.
Good morning, everyone. Pleasure to be here. I'm Chair of Pediatrics at Bronx Care and also the founder and lead for the Bronx Human Trafficking Task Force, and looking forward to our discussion. Thank you.
What was that? Bronx what?
Bronx Human Trafficking Task Force.
All right, thank you, Peter. Guylan Harrison.
Good morning, Assemblyman, Mayor, and everyone. Thank you for hosting this meeting. I am the Dean of the School of Criminal and Social Justice at Monroe University. Through the years, we've collaborated with partners to offer programming and workshops on human trafficking, and we've even incorporated self-defense training provided by our faculty, law enforcement faculty. So we just want to share resources, help with the education and help in any way that we can. Thank you for having me.
Thanks for being on. Jacqueline Colazzo.
Good morning, everyone. My name is Jacqueline Collazo, and I am the Sector Director for Domestic Violence Services at Volunteers of America, Greater New York. We have emergency shelters in the Bronx, Brooklyn, Queens, and Manhattan. And we also have a rapid rehousing for human trafficking survivors at this time. I'm here because I definitely look forward to us strengthening our partnerships with NYPD as well, and definitely providing more options to our survivors of human trafficking as we're seeing them across all of our DV shelters. So the need is out there, and I'm here to listen and learn as well.
Quick question for you. We run into this a lot. I'm just curious. When it comes to the rapid rehousing for human trafficking, is that mixed in with the DV victims, or is it specific to trafficking?
Specific to human trafficking.
Okay, thank you. All right, Ruby Paniagua. Paniagua, maybe. Ruby, are you on? Okay, we're going to move on to Allison Boak.
Oh, you got it right. Good morning, everyone. My name is Allison Boak. I am the new director of Lifeway Network just since July, but I bring to this position more than 25 years of working to address human trafficking in more than 12 countries. I'm the founder of the Westchester County Anti-Trafficking Task Force for 12 years. I'm the chair of the Brooklyn Task Force's Subcommittee on Housing, founder of National Human Trafficking and Disabilities Working Group, Freedom Network USA, and I've worked with law enforcement in about 10 countries. I'm really interested in being here today to advocate for more resources for dedicated trafficking housing. Lifeway Network has provided housing to more than 160 women from 38 countries. We have 2 safe homes. We also have an education program where we've educated more than 30,000 people on human trafficking. I also want to share some ideas that I have on how to improve the law enforcement response in New York, since I've been doing this work kind of globally for many years. Thank you so much for the invitation. I look forward to collaborating and discussing this with everybody.
Oh, thank you, Allison. I made a little note about that with the law enforcement.
Great. Thank you.
You're welcome. Joseph Riley. Oh, sorry. You know what? Before Joseph, I have Isa Ngozi Shonian.
Hi, good morning, everyone. My name is Isa Shanain. I'm the forensic nurse coordinator at Richmond University Medical Center. We have a SAFE program, and we see a lot of sexual assault patients in our emergency department. And in addition, we do see a lot of patients, and we just want to make sure that we're not missing anything. So one of the reasons why I'm really interested in this is I want to hear what, everyone has to say and how we can support our victims and also educate the nurses and the staff in recognizing the need. Thank you.
Isa, so awesome having you on, and
Thank
so
you.
awesome on this call to see what kind of training you can get, because right there in and of itself is us being allowed to identify what areas need to be trained because you are where you are and seeing who you're seeing. So thank you for being here. And if you don't learn as much as you could from the people on this call, we're going to connect you to people, because that's awesome. Really.
Thank you.
You're welcome. Joseph Riley.
Hi, everybody. Can you hear me?
Yes.
Joseph Riley, Executive Director for Freedom Youth Family Justice Center. What I'm here for today is definitely for connection. Our organization is focused on prevention and awareness of human trafficking and domestic violence in every aspect, you name it. We've been going to train and educate people on how to prevent this thing from happening. And also, we've been focusing on victim services as well. So I'm just here to connect with more people to see where we could help in a capacity. And my calendar is now open. So anybody who need any more training, any more advocacies, any more marches, rallies that need to be led, I already know, if you guys know me, I'm kicking down the doors and trying to get this thing pushed to a higher level.
Thank you. Appreciate your passion, Joseph. Thanks for being on the call.
No problem.
Pamela Damon.
Good morning. My name is Pamela Damon. I am the executive director for Not on My Watch. Not on My Watch is a program, a nonprofit based in the Bronx that works specifically with youth on providing prevention, education, and awareness. We have several projects that's designed to create advocates in our youth for them to connect with their peers in the schools, providing their information on ways to protect their peers and themselves. As I stated, we're based in the Bronx. We work very closely with Freedom Justice Youth Center and a lot of other advocates in the Bronx and throughout New York. So we are here this morning to gain insight, connections, and ways to combat this horrendous, horrendous crime. Thank you so much for the invite, and I look forward to today's discussion.
Thanks so much for being on. Thanks for what you do. Heather Joseph.
Good morning, everyone. My name is Heather Joseph. I am the Unit Chief of Community Engagement with the Bronx District Attorney's Office. I'm relatively new to my role, and I thought this was a great opportunity since it is my unit's goal to go out and connect and provide information to the community. And as my colleagues here in the Bronx are saying, there's a lot of things that are happening and impacting the Bronx. And I figured the best way to get knowledge and then to educate the community as well as my team is to be a part of this conversation, learn, and then provide and be an additional resource.
That's awesome. Just out of curiosity, since you're new to the role, have you connected with the Bronx Human Trafficking Task Force yet?
Not as yet.
That's great. Happy to make the introduction here today. That's awesome. Okay. We're now going to move into the chat. Okay. Okay. Eva Chavez.
Yes.
Sorry, we got you already. Sorry about that.
Yeah.
Sophia Khan.
Hi, good morning, everyone. I am an attorney with Bronx Legal Services, which is part of Legal Services NYC. Our focus is domestic violence, but we do also do immigration work with trafficking survivors. And some of our DV clients also have experienced trafficking. And so they end up having family law issues like custody and visitation and orders of protection, civil. So we represent them. So I'm here to just meet the larger network and just connect to some more resources for our clients.
Oh, I'm going to have some questions for you.
Okay.
For sure, Sophia, and even offline after this, I have some thoughts on some legislation I think you may not know exists that might really be helpful.
Perfect.
Yeah, thank you for being here, Sophia. If you can, drop your email in the chat in case our people don't have it, okay? Okay, Melinda, you're on. I believe Issa we heard from. Oh, gotcha. Jacqueline Colazzo, have we heard from you yet?
You sure did. Yes.
About that. Shane, we heard from, I believe, Bloom.
Correct.
Yep, sure. Heather Joseph. Boom. I don't think we heard from Audrey Hertzberg.
No, not yet. Good morning. My name is Audrey Hertzberg. I'm a staff attorney with the Anti-Trafficking Initiative and the Empower Center at Sanctuary for Families. So on our teams, we exclusively provide services for survivors of sex and labor trafficking. The Empower Center in particular is it's 4 years old, but some of that was affected by COVID. It's a partnership between Sanctuary for Families and the New York Health and Hospital System. We have a team of multidisciplinary providers who offer case management, OBGYN, psychiatry, psychology, primary care. We offer legal services, direct representation, as well as counsel, brief advice, and counsel if needed. We have social work interns and survivor leaders who provide peer navigation support for those who are leaving the life or still in the life, survivors of the commercial sex trade or sexual exploitation in any way, as well as survivor leadership with their economic empowerment. So helping our clients to become financially independent and move forward that way. So I'm really glad to be here. I see lots of familiar faces on the call. I'm looking forward to today.
We are too. Just out of curiosity, what's your service area?
I'm an attorney. What type? So I'm a courtroom litigator, primarily across the family courts or civil. Sorry.
I'm sorry. What's your service area in terms of physically? Is it New York City? Is it all 5 boroughs? Is it Bronx?
Oh, we're across all 5 boroughs. Yep, we're across the 5 boroughs, and then we have some cases depending that might be on Long Island, in Westchester, or New Jersey, but we're primarily across the 5 boroughs.
Awesome, thank you. Okay, anyone else that I missed that did not get an introduction?
Yes, I am.
Hi.
Hey, I'm Larry Banjum. I'm the survivor of the labor trafficking. I'm connecting to the Lifeway network. I'm from Pakistan. I graduated from the Pakistan. When I was faced the labor trafficking, my age was 27, and I'm a graduate from this program 2 years before, and I'm connecting with them to work as a resident part time. Thank you.
Thank you for being on. We really, really appreciate you being here and giving obviously your experience and your strength to the process. Really, thank you.
Thank you so much.
We may follow up with what organization you're with and reach
It's
out.
Life in Network, and then Ali Walker, director, she's hosting.
Ali Book, got it.
Thank you.
Thank you for being here. Anyone else? Okay. Sorry. I appreciate everybody being on today. Obviously, that's awesome that we have so many folks that are here with all your different breadth of knowledge and experiences and spaces that you serve in. For me, I want you all to know that when we started this task force, it was done because we identified the fact that not a lot of people like talking about this. And when we saw some of the numbers that were presented to us that the state has, we absolutely did not have to even think about it. We knew they were not accurate in terms of how this depicts the situation as itself. Just by talking with individuals like you from around the state and law enforcement and nonprofits, we know that's the case. So quantifying this going forward is going to be something that I'm personally going to be dedicated to, as well as the minority conference, in terms of just educating ourselves and the rest of the state. So we are going to provide recommendations. And while we do, and we must work with Democrat colleagues to get legislation passed, when we draft legislation, what it does is it really, truly helps move the conversation forward. And that's something that I truly value, that I believe will help and potentially create meaningful legislation moving forward. And through our advocacy and educating ourselves from all of you, I really do think this is something that will make a difference. And then the last thing I will say is this. We are not going to be able to hear from everybody as much as I'd like to talk to every single person on this call. We are very much encouraging everyone to send in writing for us to consider as part of our report. Send us as much as you want. Send us on issues. Send us on specific legislation ideas that you have. We want to include as much as humanly possible in this report. So if you feel like you weren't able to have a voice in it because there's so many folks on this Zoom, please follow up via email, and I'll have Bernadette let you all know how you can do that. And we'll send an email out to everybody also saying, hey, please get it in by probably the end of the week, if not sooner. We're going to start with question number 1 now. How can New York strengthen support for survivors and communities? And again, I want to stress, education will be number 4. So I'd love to hear on this one from our nonprofit representatives. And if anyone would like to start us up, we'd love to hear from you on what you think New York can do to strengthen support for survivors and communities that is not specifically education and training based. This helps us identify what the biggest needs are too, according to all of you.
This is Allie. I can kick it off. So as I mentioned, we provide emergency, transitional, and long-term housing of up to 12 months. We are limited to only women who are 18 years and above, but we take, if our program is a fit, we can take women from all over the country. One of the recommendations that we have that we'll share with you, Assemblyman, in our written report is the need to provide a dedicated funding stream specifically for housing that's dedicated for survivors of human trafficking, and to create a statewide network. So many of the women who come to us, they've already been in other housing, they've already been in other programs, but because those programs were not geared specifically to survivors of human trafficking, their needs were not met, and they often did not work out and were not able to stay in those housing programs. So I think that although we're often putting survivors of human trafficking in other types of shelters and programs, what we're seeing is that that's really not helping them recover and helping them, on the road to self-sufficiency. It's also really wasting resources, because I know that other housing programs also have wait lists and don't have enough for the populations they're supposed to serve. I also think on housing, if we could create some sort of statewide network, we get calls from all over the state looking for housing. And it's such a waste of time for staff members to make all these calls. Like with the Westchester County Anti-Trafficking Task Force, we have a coordinated service referral network. It's online and it's members only, and we can make referrals at a touch of a button. It'd be amazing to have some sort of referral system around the state of New York where service providers, law enforcement, everybody who wants to make a referral can do so very easily and have a list. It's an up-to-date list and just do it online. And then finally, I just want to underscore the importance. I know a big portion of today is also how we can improve law enforcement response. And I mean, I could tell you just from working so many cases with our law enforcement partners that if the survivor is not in a stable housing situation, if their needs are not being met, the investigation most often falls apart. The investigation doesn't move forward. I've worked on hundreds, if not thousands, of cases where the investigations just died because the partnership between the survivor, the victim, and law enforcement was unstable due to lack of housing, lack of having a phone number, an address, being in one place. I don't want to take up too much time. I could go on all day, but these are kind of the main points I wanted to get into the report. Thank you.
No, I appreciate that, Allie. Before we get to the next person who wants to talk, just to head up some other things people might mention, one thing that we found was when it comes to housing, that also helps address the wraparound services, right? Because there's so many different types of services, mental health, potentially addiction, variety of workforce training, could be anything. But if you don't have the safe housing, that also includes wraparound services, which
That's
I'm sure.
right. That all falls apart as well. So we are really the foundational bedrock upon which, everything kind of hinges.
Awesome. And just to follow up, I think it probably will need another phone call, but I really want to hear more about the coordinated service renewal network that you have and that you can speak to in Westchester, because if something is working in Westchester and it's avoiding some of the HIPAA stuff and some of the other privacy stuff, and it's done in a way where it doesn't have to go through this long process that some of the survivors don't have the ability to go through or don't quite understand, that's something we maybe can copy and paste, which is something we're really looking at with this.
Great. And we actually modeled it after Chicago with the Cook County Task Force. I don't know if you're familiar with the work they're doing. They're doing some groundbreaking work with their Cook County Task Force in Chicago. So we're kind of the second place to put in, to do this kind of network.
All right. So housing, dedicated funding towards housing specific to human trafficking.
That's right.
I do want to hear from somebody on this call that works with domestic violence victims housing and trafficking housing, and kind of in an effort to maximize resources has folks that are part of both of those areas. I just want to stay on housing for now. Does anyone want to speak to that? I'm very curious if someone on this call would like to talk about the importance of separating DV victims with trafficking victims, or if it's working. And there is an argument to be made that, hey, if we just need to beef up resources and it can kind of go towards everything. And if nobody wants to answer that, Allie, you're more than welcome to.
Sure, because sometimes there's an overlap, right? Sometimes someone is a victim of domestic violence, and I don't know if Larabe, you want to speak to that, but there is an overlap sometimes. But even when there is an overlap, it depends on the individual case, what type of program they'll be most successful in.
Thank you. And it looks like Lori said New Jersey also has a coordinated DV housing network. That's good to know. We'll take a look at that as well. Thank you. Send me an email on that if you can, Lori, but we'll take a look at that. Okay.
Before we move on, Brian, just on that point about domestic violence and trafficking, and I'm sure reasonable minds can disagree, and ultimately we need more resources for any survivor of gender-based violence or survivor of violence in general. I will say that because I operate so frequently out of the family court system in New York, I do think that it is important to make distinctions sometimes between trafficking and domestic violence and the resources that are siphoned for each group, because domestic violence is something I find, again, anecdotally, is given a very different treatment. I think sometimes domestic violence is something people are more comfortable discussing, more comfortable interacting with. It's more familiar. There's been quite a lot of progress made in the last 25 years in domestic violence advocacy and recognizing that it can occur in marital relationships, or that some of these notions of DV, we've dispelled stereotypes around them, and that progress has not been equal. In trafficking, people are less comfortable discussing trafficking. There's a much larger stigma that still exists for survivors of trafficking. Survivors of trafficking are often criminalized, demonized, and I see in the family court system, frankly, I'd say they're punished for what they have experienced, and that it will be seen as a real mark against them. So I think it's important to do advocacy in the trafficking, in the field of anti-trafficking, sometimes separately, so that we can keep making progress trying to approach where we are with domestic violence. And also the funding. I think that there's a lot of funding that's given towards domestic violence advocacy that is not equally provided in the anti-trafficking area.
Thank you. And just for the record, I completely agree with the fact that we should have some separate services, because at the end of the day, there are, what we're finding, educating ourselves and what you guys are telling us, huge differences. And it is something that where you do get funding, a lot of the nonprofits, which you all know, there's strings attached. And even with your DV funding, there's things that probably you ought to be able to spend it better on to better combat DV, and it's forced to be spent on other areas. So definitely, if anyone wants to speak to that, they can, but it is on our radar to look at all of the funding to all these nonprofits to see how the process is hurting folks more than it's helping. Some aren't even applying for specific reasons. Okay. Anything else? Again, doesn't have to be housing. Anyone else?
Yeah. Yes, Brian, if I could just elaborate on the comments of the other speakers. So Audrey's comments about the need for separate funding, if that is a possibility, and I think it's been a challenge to get more funding, but if it is a possibility, I would say having a separate funding line would be helpful. My experience with when I was representing clients was that sometimes they were reluctant to go into DV housing because they felt stigmatized from the other DV victims, even though, as Audrey mentioned, many times the traffickers were intimate partners, so they were DV victims. But there was a sense that because they had been forced into the commercial sex industry, that they were going to be looked down on by the other women, and it made it an uncomfortable setting for them. And so they would decline if it were available. Um, Not always, but enough to think it would be helpful to have something where they had specialized services. The other is just a very practical issue, which is some of them didn't qualify for the DV housing, even if they were being trafficked by their intimate partner, because they didn't have children with them. They might have had children, but the children might not have been in their custody. And New York State was requiring for the beds that were being allocated for DV victims, the way the rooms were configured, I couldn't have two single clients without children in the same room. If they were adults, you needed to have an adult and a child. And so, I was always trying to find like housing for clients who had been trafficked, who had kids, but we sort of gave up until one day we had a client who was 8 months pregnant, who had run away from her trafficker. He had been beating her to try to abort the pregnancy, and she ran away to save the baby's life. And when I took her to a DV shelter, they said, okay, we'll take her because she's 8 months pregnant, but if she miscarries, she's going to have to be discharged because we don't have a bed for a single woman. So here I had this pregnant DV victim who was brutally trafficked, and we really had to take a gamble. And I thought, I don't want to be in this situation of having my client become homeless after she miscarries because she was beaten by her trafficker. Fortunately, that child survived and is flourishing. But nobody should ever be put in that position.
And Lord, we had the opposite experience in Westchester. That's where we had a young woman who was pregnant and she miscarried and got kicked out because she was in a special shelter for pregnant and mother babies. And she was still in the hospital, and they gave her 48 hours to get out of the shelter. She wasn't even out of the hospital, and she was supposed to get out of the shelter. It was like just disgusting.
Yeah, I think some of the shelters are obviously, you guys probably know this by now. When I speak to folks in my capacity as an assembly member, even here in the Hudson Valley, it's tough because if you don't have a safe home and you're in a shelter and it's with the social services department, it's just an imperfect situation. A lot of the traffickers know where to find these individuals. There's access to areas where you can just kind of get into the same problem. So I would love to hear from somebody, if you have a minute, on some of those experiences. Obviously, hotels, we don't need to get into on this call. It is on our radar. It is not a good situation. We need to crack down from a law enforcement standpoint. We need to figure out ways to better house that don't include some of these hotels. We need to crack down on the bad hotels and create more laws and disincentives like they've done in some places like Long Island. But when it comes to housing, does anyone else have anything else to say? Or is there another issue that you guys want to chat about over the next couple before we move on to the next talking point?
Brian, I agree with everything that has been shared with different speakers at this moment. I just want to add one or two different angles and insights onto the separate funding. I think in your state, I do hope there's a separate funding for trafficking, and it's actually very needed as soon as possible, because when the funding also has a voice for the policy and for what weights on these issues. What it can bring is a lack of funding for the human trafficking survivor. The connotation can be trafficking. The victimization of trafficking is not sufficient for them to be able to get the help and support that they need. It actually extends to beyond the service they need. It goes beyond to when they go to Social Security offices, when they go to HRA offices, when they show that they prove they're a human trafficking survivor, but they're not a traditional DV survivor or other type of survivors, which people know more about because the history of those crimes are longer and funding is more sufficient. That creates another trauma for these survivors when they are along the way of recovery. So, and also it overlooks a little bit on the labor trafficking survivors. Housing is a reflection of it. So when the resources are together, coupled with DV and trafficking, I do think a portion of labor trafficking survivors are impacted in this way. That's why also like separate funding is very necessary at this point. I think some other panels have mentioned single women. I also want to bring up men. There are increasing numbers we have seen that survivors identify themselves as men, and there are just simply not enough resources to be provided to them. Housing is almost like zero for them, except for general homeless shelter in the city, per my experiences. And the most transitional home, the shared living space, are for women identifying survivors. So the men, especially with the migrant crisis and everything that we're going into in the next couple questions, this is an area that I think we need to pay attention to as well, and that speaks to the need of resources.
Okay, thank you. If any of my colleagues are on the call, if you jumped on and off, Assemblyman Novikov, Assemblyman Lang, and Pirzolo, do you have anything to chime in on?
I'm okay, Brian. I am just happy that we have, as I said, these people on here, and we're talking about different facets and branches of this problem that I've never really encountered, and I see the supports, and just hearing about the women who are allowed into a program or a shelter because they are pregnant, and if there's an unfortunate miscarriage. So I mean, there's just so much of a wraparound service that has to be like, if you give it to a person who has a tremendous unfortunate setback, you're thrown out on the street, there has to be some sort of give there. And I don't know if that's a legal challenge for us, or if that's just the way the programs were developed. But maybe we could suggest in the future, as these programs are developed, to take into account those considerations.
Thank you, Sam. I think most of the folks on this call would agree, and I don't know you all, but I've just been talking to so many people like you throughout the state that the issue is not necessarily the rules that these folks are trying to abide by because they're there for a reason. It's the fact that we don't have enough housing. So figuring out ways for the state to overcome our housing shortage and our safe homes shortage for both domestic violence victims and trafficking is the biggest issue why that problem exists. And I could be wrong on that, maybe in these specific situations, but my gut tells me that's what it is. We are going to move on unless someone has one more item on that. We hit a lot on housing, separating funding. We hit on a lot. But is there anything else that you guys wanted to chime in on before we move on to the next topic?
If I may just briefly, and this is maybe left field for some guys, but I also work as a consultant at an HIV shelter. And because HASA has a lot of funding, I have clients who, for lack of a better word, knowingly got themselves infected with HIV.
Wow.
So that they could enter the HASA shelter system because it's cleaner, it's safer. There's a lot more funding for rent. And because the understanding, when you guys say in the life that they understand that HIV is managed with 1 pill a day, one shot every 6 weeks, going to every 6 months, it's no longer considered a terminal illness. It's very manageable. And and again, sex trafficking, a lot of sex traffickers are infected with HIV, but because they take their medication every day, they're undetectable. So they still have unprotected sex. They don't have to tell, their customers that they're positive because they're maintaining their health. So they may not get benefits per se, but they get housing. And then they support that housing by working in this trade.
Wow.
That is jaw dropping here, to be honest.
And that's migrant workers and New Yorkers and people from the 50 states that are shipped into New York because they have HASA, and a lot of most other states do not have HASA. So they learn if they have HIV, come to New York because there's HASA, which provides housing.
I've been working. I was an HIV counselor for over 20 years, and people have been doing that for over 20 years.
Wow.
Exactly.
Not just migrant workers. People have been doing that for a very long time because of HASA. So it's nothing new, actually.
Exactly. I just wanted to throw it out there just because I don't know if it's even considered.
It's good. Somebody explain HASA to me.
HASA is a housing program for people that are HIV positive and have AIDS. And it's just an easy program to get into once your viral load or once your numbers are a certain way. Now because they know that people have been doing it like on purpose, they have changed some of their policies, but it's just an easy program to get into once you have HIV.
And who administers it?
It's a federal program.
Federal program, okay.
Right? Is it federal or is this it? I believe it's federal.
It's federal, but I think only New York and Chicago have it.
Somebody with knowledge, put in the chat some info on HASA, what it is. We're going to look into that a little bit. That's very interesting. And as wild as that is, it also could be an opportunity, honestly, to model certain housing, to model certain processes. That's very, very interesting. Okay, thank you for bringing that up. Really appreciate it. We are going to move on to have to, but again, there's some other things that you want to bring up that haven't been brought up on this particular topic, put in writing. That was awesome. Thank you all.
No problem.
Okay, question number 2, what coordination and tools do law enforcement and prosecutors need to better combat traffickers and help victims? And before I get into Allison Boak, because we're going to get back to you, I do want to hear from either our Bronx DA, our FBI, all of you I want to hear from, but whoever wants to start.
I'll jump in and just very quickly reiterate, because I already, like I said, you said I spoke to you already last time about it, but I'll just bring up for this group also the things that I had mentioned last time, but I think from the prosecution standpoint, And I think one of the biggest things is a model similar, and this I think is a lot more tricky, but a similar model to like the special narcotics prosecutor that has citywide jurisdiction, because like narcotics cases overlap in different boroughs, and it allows law enforcement to have an investigation that covers multiple boroughs and prosecuted by one agency. Currently with trafficking, especially with the dynamics of New York City, the layout, every investigation we have touches on multiple boroughs. It's very rare that it stays in Brooklyn. It's going from Brooklyn over the Brooklyn Bridge to Manhattan, or across the street goes into Queens, it goes to Bronx, and they all touch, and kind of we all speak amongst ourselves sometimes and evaluate where most of the horrific acts happen to spare the victim having to testify potentially in multiple different jurisdictions, and kind of work on that way. I think if there was some more coordination where there was one central special human trafficking coordination part where one agency potentially could prosecute all those cases, I think can definitely help. And then I also mentioned the hearsay exception for sexual assault and trafficking victims, where currently for trafficking of a child and also for an adult, we would have to have the victim testify in front of the grand jury within 6 days. In a situation where we can't make an evidence-based case and we don't have the corroboration that we would normally try to do without relying on the victim, police make an arrest under the laws now. There's 6 days to get that victim ready and to testify through all that trauma that they go through, and then testify in front of a grand jury. And obviously that's very impractical and not trauma focused and friendly. And in situations where someone's been arrested, and obviously we want to keep a violent trafficker incarcerated, they're walking out of jail 6 days later because oftentimes the victim is just not ready to testify, even if, and that's situations where they want to, but also getting the returns back, subpoena returns. I think the investigation takes a lot longer, and currently the way the New York State criminal procedure grand jury laws are structured, I think is very unfriendly and not good for victims of these type of crimes. I think that might be something that could potentially explore that, where we have hearsay similar to the federal system and most of the other states around the country where that don't even have a grand jury system. But certainly in those that do have grand jury, they're allowed to have the officer testify to the hearsay of what the victim said and then present that evidence to the grand jury.
Yeah, David, you did bring this up, and if you haven't already, send us an email specifically on the hearsay victim's testimony.
Right.
Just ask you, when it comes to the testimony and the 6 days, when you go into the discovery laws, are we still going to have the same issues where some of that information will then be accessed by the traffickers or the individuals that they're trying to get put behind bars? Do we also need discovery law changes coupled with whatever hearsay victims testifying that we need to do with the law?
Well, I think for discovery currently, I mean, they did amend the law to for like sex trafficking victims, certain things do get protected, and obviously we're able to do protective orders for those other things. But on discovery, I think as a general thing from a prosecution and law enforcement standpoint, and as it relates to trafficking even more so, I think having that coupled with 30/30, that timeline just makes it very difficult to prosecute a case when you have the 30/30 requirements and the overwhelming amount of discovery that trafficking cases present. I think gathering all that evidence in such a short amount of time, where then the speedy trial clock keeps running, I think that definitely is something that does get affected. So I would kind of split away discovery from 30/30.
You think it would be two separate things? Is your recommendation?
I would, yes. I think if while we're gathering discovery, I think not having also that 30/30 clock, I think that's a very big like thorn of like rushing things and potentially overlooking things, and things may get turned over that potentially might be problematic because we're trying to make sure that we turn everything over so the case doesn't get dismissed because of a discovery violation. So I think it's causing everyone to just, I think, go a little bit quicker and sometimes not as careful as they need to be.
Okay. Anyone wants to kind of couple that with another thought from law enforcement or build on that or something completely separate? But David, we're going to keep building on that. There's a piece of legislation there. I think there's probably more than one, but there might be one big one too. We're brainstorming on how to best approach that in our recommendations. Go ahead, Lori. Oh, no, you didn't have anything? Okay, sorry.
If I could add a couple ideas, they're kind of small scale, minor things, and I think easy fixes. One is that in the sex trafficking charge 23034, under subsection 1, it lists some specific drugs that if a person is provided, then that would be sex trafficking. But I think from a victim's perspective, it doesn't really matter much what drug they're given, as long as the drug is given to them for the purpose of kind of either making them more likely to engage in commercial sex for their trafficker, or sort of to lower their inhibitions, or to kind of knock them out or whatever. They don't always know what drug they're taking. They don't always know what they're being given. And you know, if they're given alcohol, and alcohol does the trick to get them to engage in trafficking, I don't know why we have a specific small list of drugs there that would count as trafficking while other things don't. So I would amend the law there to sort of allow for basically any substance with the intent of using it to increase the probability that someone engages in prostitution on someone else's behalf. There's also some issues, I think, with prompt outcry. So for sexual assault, if a person sort of discloses pretty early on that they have been a victim of a sexual assault, then that leads to favorable inferences about the veracity of what they're saying. I've had judges not interpret that the same for trafficking. So if you're, rescued and immediately disclosing that you were a victim of trafficking, where essentially you were being forced to engage in sex against your will over and over and over again, I think it should get the same treatment as a sexual assault in terms of a favorable inference regarding that prompt outcry.
What does that mean when you say favorable inference from a process standpoint? What are domestic violence victims getting when they have the knowledge, one, to know that, to ask that, and to disclose that? Because that's another part of this. And if, say, you were a trafficker and you knew enough to disclose this, what would that mean? What does that look like?
Well, so, the fact of the matter is that most people don't disclose their sexual assault right away, and they don't disclose their trafficking right away. But the law sort of says that it really lends itself to the person's credibility if they do disclose right away. That kind of a jury can take that as a factor when they decide whether to believe the victim or not, that they disclosed pretty quickly. And in the rare occurrence where that does happen in a trafficking situation, say a person runs away from the trafficking situation, or we do an operation where we extract a person from the trafficking situation, and they do in fact disclose trafficking victimization, it should be given, I think, the same treatment as sexual assault cases get, when a person makes that quick disclosure about their sexual assault.
All right. My initial thought is thank you for all that information, but my mind goes to the nonprofits and the advocates who are on the call. Do you guys have knowledge of this? And it's okay if you don't. That's why we're here. And do you feel that you would benefit from knowing that some of these things exist for disclosure? And real quick, before we get to some of the nonprofits chiming in, and I do want to hear from FBI and others in law enforcement, Stephen, when it comes to the prompt outcry, how long do they have to say that they disclosed early enough in the process? What does that look like?
I don't actually know specifically. Dave, do you happen to know? I don't remember exactly what it is, or if there's a case law on what prompt outcry the timeline is.
Just real quick, and for someone, before we get to the nonprofits to answer that, I would just throw out two other quick things, piggyback what Steve was saying, that currently, and we see that on a lot of our investigations where we're working with victims that have cognitive and developmental disabilities, where they can elicit exactly what happened, and they won't be able to say that I was forced under this element of coercion to engage in sexual for money, and then I received payment, where it's kind of like, they brought me to a room, I engaged in sex with several people, and I don't know anything else. We can't charge trafficking, even though we know what's going on, because the victim can't talk about any of those elements. So I think I noticed, I think the Assembly in the recent changes with the sexual assault changed it to include developmentally disabilities as an element of that. So I think potentially having that for trafficking as well, where a victim who's engaging in prostitution as well being developmentally would be able to have that element for trafficking. I think that could go a long way as well, because we've had several investigations that because the victim can't disclose some of those elements, we've had to close, we couldn't make an arrest or move forward because they just said they blacked out, they woke up, they had sex with 15 people, and they never saw an exchange of money or they never saw anything like that. And clearly we know they were being taken advantage of. So I think that would be one. And then they also changed the penal law to allow for elder abuse victims and I think children under 12, if they do have to testify, to allow a certain type of social worker to go into the grand jury and under the secrecy laws and things like that, potentially maybe for sex trafficking victims as well, or minor victims, to have a social worker next to them when they testify, I think would go a long way as well to making them feel comfortable.
Thank you, David. And if I haven't said this already, when it comes to some of these laws that have been changed with DVs but haven't been touched with trafficking, if you can recall, we're going to have our team and our staff look into this as well. Whatever can be changed to offer the same type of services and advantages for trafficking victims, we want to make sure that those are pieces of legislation that we recommend in this report. So anything you can think of, not just that case, but anything else that has changed over the years that hasn't for trafficking, we want to know that so we can put in the report recommendations, okay?
Yep, I'll send that.
Okay. I think it's Brian, right, from the FBI?
Yes, thank you for giving me the time to talk about this, because I know that everybody could probably talk about this for hours. I'll try to keep it quick. First part related to law and prosecutions. I'd reiterate what David said regarding a special prosecutor's office. I do think beyond that, the general theme is a better coordination. So having a special prosecutor's office, likely having a special assistant United States attorney in both districts, at least down here in New York City, and the increased coordination between services, the foundational services at least, across NGOs would help tremendously. The other thing, which hasn't really been discussed, I think, is looking at open air sex markets and the sex traffickers that work within them, looking at it as a criminal enterprise, because there takes a certain level of coordination and balance for them to exist. While it may seem, and while there is competition amongst them, the individuals that operate within them, there does take a certain level of coordination and balance for them to even exist in the first place.
So the coordination and balance, is that going to lead to a larger penalty, a different code that's in the federal law that says you do X amount of years if you're part of a larger group?
Yeah, it allows for prosecution, at least at the federal level, under the RICO statute, which
RICO.
makes it,
yep.
Yes,
okay.
Which allows for the ability to charge more people in a shorter period of time that are involved in trafficking of individuals. And there's a case out of Atlanta from 20 years ago that used this exact model to prosecute sex traffickers that operated on one of their open air sex markets.
All right. For you specifically, and I don't know how comfortable you are and able you are to answer this question, when we talk about federal laws and we talk about state laws and we beef up state penalties for trafficking, does that now go under the purview of state police? Is it always a collaboration? Should it always be a collaboration? Does the FBI get into some of the state statutes as well as the federal statutes? How does that work?
We work to bring cases wherever we can get them prosecuted in the most efficient way and where the statutes themselves are beneficial to us charging traffickers. I've worked with David for at least a decade now, Dave, I believe, where we do have at some level some cases going to the state. I do think the discovery laws have made it a little bit more problematic based upon my experience in the past, but absolutely there should be coordination amongst everybody involved here.
But my question would be, if it's a state law that's beefed up and a state penalty, the FBI has no issue being part of a case and even leading a case that is a state law that's creating the potential for getting someone arrested.
I could talk on my behalf, and I know that I would be very willing to bring it, whether it's state or federal, obviously the direction of my office, but we have no issues with working with the state and kind of our hands are open to doing so.
Fantastic.
Assemblyman, in Westchester, they've prosecuted cases concurrently. So we've had Westchester County DA's office and say Eastern District, do joint prosecutions for both state and federal.
All right. Brian, if you have any recommendations on the discovery law changes, whether it's specific to trafficking and domestic violence, or if it's in general, obviously we know some of the main ones in general that we want to change that were done, that I believe are really hurting people. But if you have any thoughts on specific language and it's not, inappropriate in your capacity to do it, or if it is just smoke signals, maybe. But no, any advice you can give on some of those changes will help our team. Okay.
Yeah, I'd have to talk internally about it, but absolutely.
Thank you.
You're welcome.
All right, we're doing well. We have hit on a lot on law enforcement, and I've had some conversations with some folks on this call already about a lot of things. I do want to hear from the nonprofits real quick, anyone who would like to speak to their perspective when working with law enforcement on some of the discovery stuff. Obviously, if they have time to prep, is that something that falls into some of the services? How educated are all of you on that? Does there need to be some training, you guys training law enforcement on things to say, and then law enforcement training you guys on what laws exist and how you guys can talk to survivors? Does that happen enough? Should it happen more? Any thoughts on that? And I know that hits on training a little bit, but since we're all talking about it, might as well have a quick combo.
I can speak on that. This is Joseph Riley, if you can hear me. Just to let everyone know, when it comes to serving victims, Monique Riley, if anybody's worked with her, that's my wife, by the way. She has no issues with bringing in the victims or survivors and getting information that is needed to assist them and also assist law enforcement. I think what works for our organization is that not only do we have the experience as social workers and case managers, but we also have lived experience on the end of domestic violence and human trafficking on a lot of the people that volunteer with us and ourselves. So that works. As far as trainings, we do trainings all year round for anyone, and it's catered for anyone, for children, for law enforcement, for teenagers, for parents, for adults. I think our key thing with our organization is to spread prevention. And that's what we need to nail it at. I think the more people know about human trafficking and domestic violence, the less likely they'll fall into those situations. But as far as victim services, we offer them everything. And we don't combine them. We keep them separate. We keep human trafficking victims and domestic violence victims separate. And we also give trainings to victims and the batterers of domestic violence and the survivors of human trafficking. The clear objective is just to understand these people are being beat down already. The last thing that we need to do is beat them down any further. To rebuild them up and make them back into an intricate part in the community, and that they also can speak out against these things that are happening to them. So to speak to that knowledge, we are always welcome to receive more training. We're always welcome to work with anyone, not just in the Bronx, but all over New York, because I live it day to day with my wife. She's a victim and she's a survivor, and now she's a thriver. And I live it day to day. And I refuse to see my children go through this situation. And I refuse to see our future go through this. So I'm open and available to not only receive more training from law enforcement, from other organizations, but also give it to you guys as well.
Well, thank you for that, Joseph. Appreciate you. And we'll come back to you on question 4. And thank you for your wife and her strength and what she does every day. Okay, we're going to move on.
Brian,
Yeah, go ahead.
I'm sorry, I had my hand up, but I'll take it down.
All right.
So I really appreciate the insights from the prosecutors on the call. I do support the recommendations that they're putting forward to help preserve evidence so that they can prosecute these cases. But I would take it back a step further. So that's assuming these cases actually get to the various DA's offices, or in Brian Gander's case, to the U.S. Attorney's Office. What we see is a lack of training still among NYPD to properly identify these cases, and they're not being recorded as trafficking investigations. They don't show up in CompStat reports. There isn't a trafficking category in CompStat, and it's not prioritized as a result. Really, CompStat is it becomes an important public relations tool to show how the NYPD is working. And if it doesn't get reported and it's not being publicized, it's not being investigated sufficiently. And from our perspective, we see that there's been a decline, even as the problem has grown, in the ability of NYPD to really properly investigate this. So I want to throw that out. And, I think the prosecutors are doing the best they can with what they have, but they're not getting nearly enough information. And we don't have a handle in New York State on how many trafficking cases actually, you know, are being addressed. They're just not. So that's one piece. The other piece, in terms of law enforcement, is there is no discussion at this point about demand and demand strategies. And, patronizing a trafficking victim is a crime both under federal law and in New York State. We're not seeing enough being done. And, in response to the movement towards full decriminalization, we would say that would be a recipe for expanding the opportunity to traffic individuals in New York State. What we really want to see is enforcement of laws to make sure that people who are patronizing and generating the demand are being apprehended. And we believe that, if you have some arrests being made of Johns, that would do a tremendous amount to shut down this industry.
Thank you, Lori. We do have to move on to the next topic. If anyone has anything else on this, I know that there were a bunch of issues we could have discussed with the people that are here. Follow up in writing, follow up with a phone call to me in my office, Bernadette. But we will have a pretty short turnaround since we're looking to wrap this up and put the report together. But please reach out, put it in the chat here, shoot us an email, just get us as much information as possible. We are going to move on to question number 3. Which is what impact is the migrant crisis having on human trafficking crimes within the state? I know that Melinda, you brought up HASA and some of the issues with folks. Just to start us off, a quick question, and if you don't know, you don't know. Obviously, it helps having it pointed out to us that this has also been happening for the last 20 years. When it comes to the migrant crisis, what we are trying not to do is to demonize and to say, hey, let's just figure out ways to figure out reasons to get everybody out of this. That's not kind of our focus here. Our focus is how are we seeing our resources depleted, and how can we make a better argument if we're spending $4 billion as a state to repurpose some of those dollars in areas that perhaps are getting missed, right? So we want to quantify the problem so that we can take resources that we know are already going towards this problem and make sure they're hitting the places they need to hit. So in case anyone had an idea on where I'd like this conversation to go, that's where I want to be able to quantify what areas the migrant crisis is having an issue. It's not political. We want to identify how resources are being depleted and where that happens.
So I would definitely say housing, right? Because it's supportive housing. It's supportive housing. It's so that it's, and again, I can only speak for the small segment that I work with. So oftentimes they're seeking asylum because they're non-binary or homosexual, and that can be a death sentence in their country, for one. Two, they're coming from countries where if you don't have the money to pay for HIV medication, you don't get the treatment. So they come here for the treatment. So then that also means that, again, just from the segment that I work with, there's a large population of people that are coming in that maybe were trafficked in their country before and just saw it as a means of survival. And over here, it's it's almost looked at the lesser of two evils because they get to take care of their health, they get to have housing. Um, but on the flip side, they don't go to the police because they're undocumented. So it's a perfect storm.
All right, that's great. That's not great, but thank you for
Right.
shared.
And one more thing that you, again, then I'll leave it out. One more thing is a lot of the men that are coming that may have lived a quote unquote double life, they identify as bisexual because they don't even want to say that they're homosexual. But if you dig deeper and say, when last did you sleep with a woman? They're like, ew. But it's easier to say bisexual than it is to say homosexual because where they're from, homosexual can be a death sentence.
Sure.
So, yeah.
I want to go right into a different direction with this, with
Okay.
our attorneys and our social work organizations. When it comes to the migrant crisis, when it comes to the folks that you serve, how have you seen your caseload go up? How have you seen your ability to serve the people who are coming in for applying for all of these different types of visas and asylum? I would really love to hear from some of our nonprofit legal services on the call.
I can start. I'll start by saying what I think everyone on the call probably knows, which is that not just in New York, but everywhere, there are not enough resources. There are not enough legal resources to meet the need of survivors who are seeking assistance, who I would say the majority of whom are right now without status and are seeking status on the basis of their victimization. But even those who have some status or did, but it's expiring, there are all kinds of immigration needs. And there are not enough resources. And it's a really high fear environment for our clients. And they really do they need support, and they need legal representation. They need social workers or clinical support for therapeutic services. So it's not like it was really always amazing before, and now there's this catastrophic change. There's always been fewer resources than the need. The supply has never matched the demand. But I think it is striking how much higher the need is, and also the attitudes around how the clients are feeling. Clients are really afraid. They're really scared. The phone calls over the last month, especially, they're terrified for what the future holds for them, and it really does limit their opportunities to leave this life because they don't have work authorization. Now, there's these new rules, for example, that you can now apply for work authorization with your initial T visa application, which is great. But if you don't have someone helping you apply for a T, then it doesn't really change your life. That doesn't really make a difference for you. So it's very difficult for those who are desperately trying to find employment and to become financially independent and are unable to do so because they don't have anyone helping them. And it's a tricky, tricky system to navigate.
Well, thank you. When it comes to more attorneys, more social workers, would you also say the need for more judges and the need for more specialty courts for trafficking is a topic that we want to be able to advocate for?
I don't know if anyone else wants to jump in as well. I would say it's interesting. I mean, in New York, in the 5 boroughs anyway, there was for a period of time these thriving human trafficking intervention courts, which the need for them has shifted as arrests made of people being trafficked or victimized has decreased. And so the HTICs are no longer how they were operating, let's say in like 2018 or 2019. I know there's a big initiative happening in the family court system to create trafficking specific, not just trainings for all the new judges and magistrates sworn in, but also an actual part that would be for human trafficking survivors in the family court system. But we always need more training and more resources for survivors in criminal and civil and immigration. I think the issue is, even when there is training, sometimes it takes survivors a long time to want to come forward and disclose their status as being a trafficking survivor. They know it will be treated so differently in the court system than a DV disclosure. And then there's also lots of fear. I mean, if somebody's engaged, whether it's criminal or civil or immigration, in a case against their abuser, there are going to be a lot of barriers to why the court system isn't going to be a place they may be able to seek the justice that they're searching for. But I think really, although I'm a lawyer, I really think I like to emphasize the social services and those kind of more basic needs. If we're looking for places to put funding, I would highly, highly encourage funding for housing, for economic support for survivors, for connection to clinical services that can help them to feel supported and to feel empowered. And then, of course, legal services. But jumping into a legal case could be more damaging to someone who's already living in a really vulnerable place or is already a part of that vulnerable population.
Well, thank you for all that. Yeah, you certainly hit a lot that we've been hearing. And one bill that's out there that exists is a incentive bill for nonprofit immigration attorneys, not just nonprofit, but immigration attorneys that will work with the Public Service Loan Forgiveness Program and enhance it. So the state will actually pay the minimum payments or a portion of the minimum payments for that period of X amount of years. And then more people are likely to go into the program because they don't have to worry about those payments as much. And it will create more people to go into the industry who are saying, oh, do I want to practice immigration law or some other law? Would you say that would be a great benefit to people going into the field like yourself?
I would love if lots and lots more people wanted to go into this line of work, of course. So anything that could encourage not just not just people who are new providers though, but also sustaining the current providers. I think a really big issue, and I'm sure others could speak to this as well, is turnover, difficulty with making this a sustainable lifestyle for providers in New York, and that it's just it's nonprofit work. So it's just a highly underpaid field in general. I'd say across the board, the medical providers I work with say the same, and they're working at hospitals and they're largely donating their time to us. So it's not a, I don't know what I would say, well compensated area. So not just getting new providers, also supporting the providers who are already so committed to this. I mean, if you want to be in this work, then probably that compensation will be something you're more willing to compromise. But there is a point, especially in an expensive place like the 5 boroughs of New York or New York State in general, where it can be untenable for anybody.
No, points taken. Thank you. Anyone else on the migrant crisis and its impacts on trafficking?
Yeah, one thing I'd like to add is just there's been a tremendous lack of awareness for the migrant arrivals. I think somebody on the call mentioned, the migrants aren't necessarily being trafficked to the United States, but they become extremely vulnerable to trafficking upon their arrival in this country for the reasons that were already discussed. And there has been a lack of information to those migrants about what is human trafficking, what does it look like, what happens when they're provided or given a job offer that looks too good to be true, and that it really is. And also there's been a lack of training for the shelter providers on screening and looking for vulnerabilities of trafficking. And, we're talking a lot about aftercare and how to respond once someone's been trafficked. And what we're really trying to do is advocate for prevention strategies.
Thank you for that, Lori.
And just real quick, I think it should be noted too. I think that we assume that everyone at these shelters are like licensed social workers, and they're not. Some of them have bachelors, some of them don't have bachelor's degrees, So it is like Audrey said, that it's low paying work. The training is not as robust as it should be. I come in and do assessments only, but I see so much areas where those programs are lacking what they need to really service those clients. So I think we assume we use this word, social workers and case managers, but case management can be a high school diploma depending on where you work. And then the salary is low. And then again, you see those elements of turnover. So there's a lot of broken parts in that system.
You're right. You're right about that. I was a staff member before I was an elected member, and working with people, I feel like I was a caseworker to a degree in some situations. So there's certainly a lot of that type of work to go around. Okay.
Just adding, sorry, I just want to add into the points like here quickly, because I definitely agree with every point shared here as well. And I want to provide two examples. Our case managers have been having a hard time to find immigration attorneys for the survivors we serve. When a referral arrives at Audrey's desk, but before that, there are many tries every case manager are trying right now. And that is tons of organizations, either they're closed for wait list or having a wait list, and the waiting time is a couple months at least. So that's just the reality that we as a nonprofit are facing right now. And then with the migrant crisis, once they are identified as survivor of trafficking, they're eligible for a lot of resources and services. Yes, theoretically, the no part is if they're living in a temporary housing, such as a hotel, where do they go next? And it falls back on our case managers if they're in a case management services. And where do we go to resources? We know the cake is just this much. Like Restore has a housing program, and we help with independent living and the rapid rehousing or voucher application. But the resources this much. Everyone is competing with the resources, and the migrant just adds like the need for the services. That's the point. What I'm trying to say. So this is an impact that we are seeing just in the reality. On the other hand, I also very resonate with Melinda's sharing. This year, we actually have a hard time recruiting MSW intern in our program. We always have intern every academic year, and this year we even hit the hardest point. One is that we don't have the capacity on, but before we decided to not having an intern, we tried a lot of school, almost every school in New York City, at least in the social work school, to recruit intern. And there's low interest for students to work with human trafficking survivors because most of them probably want to go to private practice and deepening their clinical training rather than case management or taking referrals, doing screening and trafficking assessment. That's very unfortunate. And I think that I'm concerned for the future talent building and retention in the field, in the human services too. And I think pay is a very critical component here.
I mean, I don't know how to. An immediate thought that comes to my brain is a lot of the folks that are relying on this assistance, that are looking for services as part of a workforce development training, maybe with your firm, maybe with a lot of different nonprofits. They seem like in some cases, some of these folks might be the best qualified, especially in terms of language barriers, people that need to speak from different areas. You might be looking at a great worker base of folks that can serve these positions that are currently not yet citizens or are citizens and are looking to reapply. I know we're not there yet as a state and as a country, but that could be an interesting path to hitting a couple of these, filling a couple of these gaps. Okay. Anything else on the migrant crisis? You guys gave me a lot to reconsider, consider, and some new stuff. So thank you. All right. Honestly, my favorite part, because this is a lot easier, to be honest with you, things that we can do without passing legislation, things that we can do sometimes with passing legislation that doesn't have money tied to it. Obviously, some of this, absolutely, you need money to be able to provide training and offset nonprofits. But when it comes to the last question, What kinds of education and training are needed to better equip professionals and all New Yorkers to recognize someone who needs help? So whoever wants to chime in first, we're happy to hear from you and looking forward to getting your feedback on this. We have a hand raised. Who is this? Is that Melinda?
It's me again. I would say free CEUs are always a big pull for licensed social workers. If you can partner with anyone that, is the expert on sex trafficking and immigration and all of these things and tie it to free CEUs, um, I would attend every training because that's how I renew my license. Um, I
What
also think, I'm sorry, say that again.
What is a CEU?
Oh, sorry, continuing education units for licensed social workers. And you have to have a certain amount every year. And if you don't find free ones, you have to pay for them. So if you can offer free continuing education units for something that we know, like I didn't learn until our Bronx sex trafficking meeting that a T visa was for trafficking. I had no idea because if you don't come across it, unless you actually work in it, you don't know it, right? So I didn't know with mandated reporting, as social workers, we are mandated reporters. Maybe there should be an element of sex trafficking in mandated reporting. I learned from ACS that there's a particular, code that you put in. I wouldn't know that. And I'm a mandated reporter who takes mandated reporting training every year. So maybe it needs to be infused in our education and our training because it's getting away from us.
Thank you for that. We did actually have the continuing education units come up in one other task force. I want to say it was Syracuse. Yes, we're on top of that. We may ask you for some more details on it, but that's a really good one. I like that a lot. What else?
Hello?
Hi, how are you?
Hi. I just wanted to mention, and hi, Melinda, it's good to see you, that a lot of this information should somehow be required to be integrated into basic curricula in not only the social work schools, but also in medical schools and in law schools. I find that what we're doing here with the Bronx Human Trafficking Task Forces, we will go anywhere to do a training. And it's always surprising to me that some professionals have never received any training or don't know anything about this. This is brand new. We've been doing training with nurses, for example, and they're shocked when they hear about this. And similarly, we've been doing grand rounds and medical student training, and they don't know about this either. This is new to them. And so I think, number one, we need, and I hate to bring up the money word, but we do need money to hire more trainers to work with the professional community as well as the paraprofessional, and to work with the community itself. We should be going into all of the elementary schools and middle schools and high schools, teaching about trafficking as a preventive measure and teaching professionals how to deal with this from a professional perspective. And that is something that we do. That's something that I know task forces across the country do, and at conferences and so on. And also to add on to that, what was already raised is that most people who are doing this are not getting paid for this, particularly from a perspective of medical. This is done on a voluntary basis. And if doctors don't know how to recognize trafficking when so many people do need to go to the doctor because of illness related to trafficking, that's a problem.
Sorry, I didn't realize I was muted still. Really, thank you for all that. And Peter, you guys being on the call, I know everybody's been waiting for quite a while, so really appreciate your feedback on that.
Thanks.
We have a lot of hands up. Do you want me to just read off the folks as
Yes.
I go through?
Yes, please.
Okay. We also have Mr. Riley. Unmute.
I can make it brief for time constraints. So what's free? So connections is free. Um, Everybody here is taking a bite out of this big pill. And for most of us, it's very hard for us to swallow. It's tasking. But if we all can collectively come together and get and tackle this, it'll make it a lot easier for everyone. There's a lot of people on this call that are unaware of each other. And we really need to just make use of this time, because time is something you can give and you definitely can't give back. But we need to definitely make sure that we all use this time to connect with each other, grab emails, phone numbers, and let's really take a big chunk out of this. Our future is at stake, believe it or not. It's affecting all of our families. It doesn't matter where you're from. It doesn't matter what you represent. It doesn't matter who you voted for. This is a big issue. We need the big people, we need the big guns to come out and really take a bite out of this. And I'm all for it. Anybody know you can reach me anywhere, and I'll do anything it takes to help preserve our future. So we all should be looking the same way. We all should be doing the same thing. And if and let's see what we can do going forward in 2025. This should be our year for really taking a bite out of this issue and making people feel safe once again.
I really appreciate that, Joseph. And I'll get to Bernadette with the next hand raised in a moment. But you touched on an important point. We're going to keep everybody's emails if you've given us an email. And my goal is, while we're putting this report together, to keep this group connected, to keep connecting this group to the statewide task force, the interagency task force, to make that task force better than what it is right now, because it needs a lot of work. And yeah, we want to keep this rolling. We want to put this report out and then work on it for the next couple of years. Not just, hey, here's a report, but actually, I want to be a leader personally in the field. I want to listen to all of you guys. And I put a little note down, said if you need a rally to call you. So I'm going to call you, okay? I got you. All right, where are we at, Bernadette?
We have Lorraine also, who has her hand up.
Lorraine?
Yes. I want to talk about the what you give them the education, like the new immigrants, they come from the border or they come to the sponsorship. You have to give them the education when you're taking the interviews or when we're crossing the airport. Like especially like I'm the new one, so I have no idea about the new country, new laws, and new education. But when we do for the interviews, at least we know about what we are facing in the new state. And I'm crossing the airport, and I have two points when you guys taking the interview, and second when I'm crossing the airport. So when we're crossing the airport, they give them the training or education like paper, something stuff, so we can read it and we know it if we're facing these kind of stuff like labor trafficking, something. So we have all the information. We can call 911 or we can oppose someone or any signs we can give them. But we don't have any education, so how can we approach you? After that, like if we don't have cell phones or we don't have any information to approach you guys and how we can do it. And then second thing, the crops cannot help you unless you call 911. So these things, if we verbally or give them signs, they can come to help you directly without call 911. Yeah, thank you.
Thank you for that. And you are here with Mrs. Boak, right?
Yeah, Mrs. Go.
Okay, great. Thank you. Thank you for being on. Get that feedback.
Thank you.
Brian, I was muted, I think, earlier. I have Guylaine next. Guylaine.
Hi, yes. Can you hear me?
Yes.
Can you hear me? Okay, terrific. So first, I think the continuing education, continuing legal education, trainings for human trafficking, I think that's an excellent idea. I also think that with the trainings, we can try to reach out to survivor advisory boards from reputable anti-human trafficking organizations. They can offer a unique perspective. They can weigh in on outreach, prevention, and engagement, what has helped them, whether it's trauma-informed care, signs that we can look out for. So I think reaching out to those advisory boards, survivor advisory boards, could be quite effective with the trainings as well.
What about utilizing the interagency task force website at the state level and maybe that as a resource to create a list from the regional task forces, but even some regions that may not have an active one or as active, and creating that list like, hey, if you're a school district, you can go into the interagency task force at the state level. And in your region, you can take a look at some of these nonprofits. That way they have a level of scrutiny to the
Yes.
task force. So like, hey, who do we go to? Do we send an RFP out? No, here's a list. The state is vouching for them, and here they are. What do you guys think?
I think that's an excellent idea.
All right,
Because
cool.
that way it's almost like, you're pre-vetting. So I think that's a great idea.
All right, we will put that on our list. Thank you.
And next we have Shane.
Shane.
Hey, thank you. Yeah, for the interest of time, I'll try to be quick. I think that this topic is really important. I think we could probably talk about it for 2 hours. I think it could be in its own sort of forum, looking at education specifically. I think it's important to kind of separate it into two components, looking at prevention, right? Being proactive versus reactive. Like we want to try to prevent trafficking as well as provide services to those who are victims and survivors, but we also want to try to prevent it. And looking at sort of a space specifically with youth, there's an opportunity to work in public schools at a much larger capacity. And something that, I used to work in public school myself before arriving at PACT. And something that is expressed in that space is that there's not enough resources, there's not enough money, there's not enough funding to choose trafficking prevention education for youth, for parents, for staff members. And so a lot of times these schools sort of say, yeah, we're interested in doing that. We think that'd be great, but we don't have the money, we don't have the time, we don't have the resources. We're moving staff around because we're already understaffed. There's plenty of issues that sort of revolve around the education system. That's its own conversation. But I think that one way that we could achieve this is by mandating anti-trafficking education within the school district. There are some states that have done this already, California being one of them. Obviously, it's still new. Those mandates are still new. So seeing the success of those mandates is yet to be told. But I think that in New York, specifically, New York City, there is an opportunity to sort of kind of get the ball rolling with mandating that education and then having organizations go in and make sure that staff members are trained, social workers are trained, teachers are trained, administrators are trained. Being a teacher myself before this position with PACT, I can tell you that we go through mandated reporting training as well. I know that was brought up before. I knew nothing of human trafficking before stepping in with PACT. My knowledge as a public school staff member was very limited. And now looking back on it with the knowledge that I do have, there were many students of mine that sort of displayed the vulnerabilities of someone who's vulnerable to being trafficked. I won't get into like specific scenarios, obviously, but I think that there's an opportunity to try to figure out a way to go from the state level down and mandate something within the school districts. I think that would accomplish a lot. I think that, there's obviously we brought up the migrant situation as well, which is there are many students now in the New York City public school system who are migrants. A lot of those students have unstable housing, which we talked about. So there's a lot of themes across sort of the forum today as housing is a theme and, vulnerabilities are a theme and the migrant crisis is a theme. So where are we seeing that with youth specifically and how can we combat that? How can we prevent that? So yeah, I wanted to just kind of bring that up.
Well, I appreciate that. When we consider this for a piece of legislation to recommend some sort of mandate in terms of education in public schools, which I agree with. What we would put together is something that is actually funded. What actually gets passed typically is an unfunded mandate, which doesn't help with the nonprofits who want to be able to provide the training, have the funding to do so,
Right.
and not being able to take from their funding at the state level to do so. So that's always an uphill battle, but I love it. It's something we've discussed literally every single roundtable that we've been to throughout the state, to figure out ways to get into public schools. And we've definitely identified it as a need for sure. And so thank you for making that transition to from public school teacher to this particular job. It certainly needs you, and we appreciate the work you're doing.
Thank you.
All right. I see that everybody's putting a lot of great info on the chat, so we are getting that. I am taking a look at it. Eva Chavez, that's really good. Hollywood, New Jersey. Keep that coming. And obviously, Bernadette would love for you to email us as well, any information on top of it, but we're really appreciating what you're putting in the chat. Training is mandated in other states. That's correct. All right. Anything else on education and training before I let my colleagues, if they're still on the call, say some closing remarks? All right. Do we have any of my assembly member colleagues or their staff still on the call?
Hello, Brian, still here. Thank you so much. Listening to all these things, I don't know personally a lot about human trafficking, but listening to what we hear here, what's going on with this conversation is uplifted a little bit to understand that there are people who are recognizing and working and fighting on this, but we have so much more to do and working on this. So I hope that we could stay together as a group. I know, Brian, you've been doing these all over the place. So please keep me in the loop. And if there's anything that we can do to help out, coordinating together with this diverse group of people, I'd be very happy to do so. Thank you, everybody, for being here. I really appreciate it. It was definitely a learning experience for me.
We appreciate you, Assembly member. We know your time is valuable like everyone else's. Appreciate you hopping in, hopping off, and taking the chance to learn a lot about this. All right. Do we have Assembly member Chang or Novikov on the line still?
Yes, Novakov is still here. Brian, first of all, thank you very much for organizing. Bernadette, thank you for bringing everyone together. Wow, tons of information. Thank you, everyone. And for my district, it is especially important because I represent the district with most immigrants from Eastern Europe. And, as you know, the war is still on in Ukraine. People are immigrating from Ukraine and Russia and other former Soviet Union republics. And I know it's a big issue among the Eastern European immigrants. So thank you for that. I have a suggestion and a question. So I heard about lack of housing, right? So I think it would be great if there is a program which allows the state and city residents to welcome victims of human trafficking to live in their homes, and this housing will be paid by city and state. This could be a great program for, let's say, retired folks to take care of someone and make some extra income. A quick training might be needed, but it shouldn't be a problem, having so many educational organizations. I really think that, real homes are always better than shelters, and it also will cost much less than a shelter. That would be my suggestion. That would be something we can discuss with Brian later, right? Maybe turning it into legislation. I mean, we need to do a lot of research on that.
Michael, I think it's a really creative idea. The first thing I would say is we should have a second call with some of the folks that deal with the housing and the nonprofit, see if it's something that makes sense. What a creative, interesting idea. Let's vet through it. Let's talk about it. And maybe if we have the time to vet it properly and see if it's something that is, realistic.
Right.
We're looking at all ideas because the housing crisis is what it is. People need more income. So that's a really creative thought. I have no idea if that'll work, but that's really awesome. Awesome.
Thank you, Ryan. I appreciate it. And the question that I have for basically everyone here is because we're talking, there are a lot of talks about legalizing prostitution, right? So I would really love to hear from you guys, like, do you think legalizing prostitution will help the current situation with human trafficking, or it will make it worse? Because we really don't know. So if each of the participants could send, their thoughts on this to Brian or to Bernadette, and then Brian can share it with the rest of us, I would really appreciate it because I'm really, really interested to learn your thoughts because you guys know much more than we do. So that would be it. And again, thank you so much to everyone.
Yeah, please, for everybody who's on the call, we're not going to be able to chime in right now verbally, but that's a really good point. We kind of have an idea of where we stand on the decrim issue and the equality model and what's not. But if you feel strongly about either side, please shoot us an email. Bernadette will put it in the chat if you don't have it already. Bernadette probably is the person you RSVP'd with. So please reach out to Bernadette and give us your feedback on that. Thank you, Michael. Thank you for your time too. So I'm going to finish off just by closing this out. Again, thanking everybody for their time, for their contributions. We had over 40 people on and off this call. We still have 31 on it. So that's huge commitment of 2 hours of your time from so many people. Law enforcement, nonprofits, individuals who have been doing such hard work on this. And my hope is that you all felt a very positive feeling about the fact that you have elected officials that care enough to put the time in to really try to actively and genuinely troubleshoot ideas, hear from you, and put some recommendations together for our colleagues on both sides of the aisle to consider. So we are going to be in touch. We are definitely I'm going to ask for some of your feedback continued. And as we shape up our report for January, we'd love to continue to get your feedback, but definitely when it comes to deadline for written testimony, if you will, for this process, Bernadette, correct me if I'm wrong, but what is it, Wednesday?
Let's say by the end of the week would be good.
Okay, by the end of the week, by Friday, please have any written testimony that you want to include, or people who are not on this call to include as part of the official report. And with that said, thank you again. We appreciate all of the work you're doing. And definitely a special shout out to Lorraine and to Monique and to the survivors that take time to contribute and to have the strength to be part of this process and to advocate. We appreciate you. Thank you.